Hi, welcome to House Healthcare. 9:05 on Thursday, April 24th, and we're turning to S98. We have draft 2.2 on our committee page, which Lex Council will walk us through. And as a reminder, this is setting up the authority for Green Mountain Care Board to look at and plan for an implementation of prescription drug cost regulation that came from the Senate. And then we have added language pertaining to the Green Mountain Care Board nominating board. Jen, I'm going to turn it over to you.
All right. Good morning, Jen Harvey from the Office of Legislative Counsel. Nice to be back in here. We are looking at draft 2.2 of the S98 amendment. It is not a strike all, so remember that part. And as we've been looking at it before, the only changes were relating to the new language on the Green Mountain Care Board nominating committee process. So the first change here is a new potential instance of amendment that would go into the underlying bill and into the list of what the Green Mountain Care Board is supposed to be looking at in evaluating options for unlikely impacts of regulating the cost of prescription drugs. So that's our lead-in language. And there's the list about experiences of states that have developed prescription drug affordability boards, CMS's Medicare drug price negotiation program, other promising federal and state strategies for lowering prescription drug costs, the board's existing authority. So this would be adding number 5 on the existing list is the likely return on investment of the most promising program options. And a new potential number 6 would be the potential impacts on Vermonters' access to medications. That was an issue I think that had been talked about some concerns raised in this committee. And then making what was number 6, number 7, the impact of implementing a program to regulate the costs of prescription drugs on other agencies and on the private state agencies and on the private sector. So really the change here would be to add to that list of what the board is looking at, the potential impacts on access to medications.
And one of the reasons that I asked Jen to include that with some of the conversation we had here, and we did receive several letters from Vermonters whose children are on some high cost drugs, but it's needed. And so we wanted to make sure that that was considered when Green Mountain Care Board. So let's go through the language and then we can come back to having a conversation.
So then we get into the second instance of amendment, which is that new section 4 that we looked at before. I made some additional changes and there's 2 colors I will explain in a minute. But this is about the membership and appointment of the Green Mountain Care Board. So some of this is the cleanup language that we have looked at that is just getting rid of some of the implementation provisions that are now quite out of date. But we did put in language saying any appointment to fill a vacancy would be for the unexpired term. And this language specifies that a member may be reappointed to additional terms. It had originally said an additional term. This clarifies that it's any number of additional terms. So then we get to the Green Mountain Care Board nominating committee. And the first piece there we had added, again, not new to this draft, but just since it's been a little while, making sure that the committee has the administrative, technical, and legal assistance of the Department of Human Resources. Then in 9391, so there's a couple of changes here in green, and the reason they're in green is yellow is reflecting what we talked about in this committee or direction I got from the chair. But I actually think this one came from some confusion that another member had expressed to the chair about what the governor's role is. And so I just added a reappointment by the governor in a couple of places to make it clear that it's still the governor who's doing the reappointing. It's not the Green Mountain Care Board nominating committee doesn't get to appoint anybody at any time. So just some clarifying language here that unless a vacancy is filled by reappointment by the governor pursuant to subsection C, then goes on to the process about Green Mountain Care Board starting its nomination application process. Last time we had looked at this, we talked about adding when we have a board member who's resigning before the end of their term, that they would notify not just the committee chair, but also the governor and the Department of Human Resources. Take all of this off, in part not knowing if there would be a committee chair who was actively a committee chair at that point, depending on how long it had been since the previous vacancy. The sentiment that the governor should know but, at the same time, or as soon as anybody else is knowing. And then the Department of Human Resources, so they can convene the nominating committee. And then it says, once notified, the committee chair would start the nomination application process. And we took out notify the governor because that notification already happened up on line 14.
Go ahead.
Isn't it clear in this language that the Department of Human Resources is responsible for convening the committee?
No, they're responsible for providing administrative, technical, and legal assistance. I think we had presumed that was part of what they currently do and will continue to do.
But then who convenes the committee that they can elect a chair?
That's the human resources.
Right, so that's what I'm wondering, is it clear that that's their job? Is it obvious that that's what they have to do?
I mean, it doesn't specifically tell them that, but I don't think we do in any other
So
staffing.
it's understood.
It's understood that when
Okay,
there's a
that's what I just
vacancy.
wanted, I wanted to understand.
Yes.
All right, we have the nomination list. Again, just a reference to, in the nomination list, the committee submits to the governor the names of the individuals it deems qualified to be appointed and the name of any incumbent member who was not reappointed pursuant to subsection C and who notifies, and then we have again, the committee chair, the governor, and the Department of Human Resources, so the same people, that the incumbent wishes to be nominated. And then we clarify some language in an earlier version that they don't have to submit a new application, but the committee may request the incumbent update relevant information as necessary. For the reappointment provision, this is where some of the timing plays in. So not later than 120 days, so roughly 4 months prior to the end of a board member's term, the member shall notify the governor that the member either is seeking, and instead of just saying reappointment, again, making clear, seeking to be reappointed by the governor for another term, or that the member does not wish to be reappointed. And then it goes through that process. If they're seeking reappointment and not reappointed by the governor within not 30 days, then their term ends on the expiration date unless they're nominated under the regular subsection B, everybody else who's qualified processed and subsequently appointed or as otherwise provided by law. And we've justified that the reappointment is subject to the consent of the Senate. So then we have the timing piece here. Unless the governor reappoints someone under that reappointment provision, the governor must make an appointment from the list not later than 45 days after receipt of the list. And the appointment is subject to the consent of the Senate, and everyone not picked remains confidential, as does all of the proceedings of the committee. And then we have the language that we had also looked at last time around the effective dates and saying this section would take effect on passage, and notwithstanding any provision of the chapter that we just made changes to the contrary, there can be some alternative timing requirements if there is a vacancy that's anticipated or occurs before the end of the year, if it's not possible to meet those timelines.
I got just a question, clarification type thing. It says not later than 120 days prior to the end of the board's member term. I think everybody knows if they want to rerun or not, 4 months.
Well, they will now.
They will now.
Well, there's a
that's
lot of
something
conflict, there's a lot of things that could happen,
Right.
you know, family illness or something.
Oh, would they must not know of this requirement.
Well,
Oh,
4 months to let them know you're gonna run or rerun is,
Yeah, I mean, there's,
I'm not disappointed with
Go ahead,
it.
Jen.
yeah, I mean, this is all sort of setting up an ideal process. It doesn't mean it's always going to play out exactly this way. But I think in a lot of cases, people know or want to know with 4 months left in their term, whether they're keeping the same job in a few months, or if they need to be looking for something else, or if they want to be looking for something else. So I think in a lot of cases, people do know if they are ready to be done or if they want to.
It's fine.
and just let's say they say in 120 days, yes, I'd like to rerun, and then there is a family illness or a health issue. We're not holding them to that, right? Like they can
Right,
say,
sure.
I can't do
That's
this.
fine.
What do you do, put them in jail?
Right.
Yeah.
No criminal enforcement provision.
Okay, yeah, I'm okay with it.
So Jen, I know there was some question around the 45 days
Yes.
and what that means.
Yeah, so the 45 days is within 45 days after receiving the candidate list. And the candidate list, I don't know that there is a specific time in here for when the candidate. So, so not later than 90 days before the vacancy occurs, the Green Mountain Care Board Nominating Committee starts the nomination application process. But otherwise, I don't believe there's a specific timing about how long they have to get the list to the governor. It's just that the governor must, within 45 days of receiving the list, make an appointment.
Right, and there was some question of what that appointment means. Is
What
it
appointment
public,
means,
is
yes.
it?
And I've been trying to get in touch with the governor's, some folks in the governor's office to understand what it looks like from a practical standpoint. But I think there are, I mean, we do a lot of appointment language in the statute, so I expect they are familiar with how the process works, including if somebody is not ready to publicly announce that they are leaving their job. We learned fairly recently, or fairly soon between the time that the new Secretary of Education began in the role, that the appointment had been made, although the application process has been ongoing since the fall. So I assume there's some element of discretion about when things get publicly announced. If there's not, we can certainly address, and I'll continue to try to connect with them to understand.
Okay, that'd be great, yes. And if there change needs to be made, it can be made in the Senate. Okay, that's great. Thank you for trying to figure that out. Okay, any other questions for Jen? All right,
And I guess I will just add on the disclosure piece, that I do have some concern about adding a provision here saying they don't have to, appointment means something different in this case when we don't say that in any of the other statutes. I think it creates some confusion about what is meant in other statutes that are silent about that.
that makes sense. Thank you. Right. Thoughts, comments, concerns?
We're obviously voting on the bill as amended.
Yes,
Okay.
yes. So it's
Right.
S 98, the one amendment we made
Plus,
to what the Senate sent over, and then the nominating board committee. Yes,
How about I throw a motion on the floor and then we can.
that would be great.
discuss it.
Sure.
I move that we approve S-98 as amended by House Health Care.
Great. All right, any other discussion? All right.
I like some of the intent of it, but I don't know.
What are you struggling with?
I get it. I get what we're trying to do. And I don't know. I don't know that we need two people to do it. I'd feel better if we had hired one person and not two. And if there was something that would kick in when the money comes out, because we heard that would happen with the advertising fund, or whatever it's called. And I would. Has the Green Mountain Care Board saved us any money so far?
They would say yes, and there's data that yes, they have. So what's
Okay.
what's hard to understand.
Hard to quantify,
is-
and I know.
Well, it's hard to, and I remember when I was a Extension trustee, and it's hard to show savings that haven't occurred, right?
Right.
So
Right.
Green Mountain Care Board has prevented
A lot of
costs
stuff.
to rise further than they have. And remember, this is to look at it and come back to us with an implementation plan. It is whoever will be in these seats to make the final determination. And I'll just also say, Green Mountain Care Board has said loud and clear that they don't have the capacity to do it without two people. Mari and then Tucker.
Just, I'm thinking about your question, Art, and then thinking about our committee only focusing on the issues around PBMs and insurers and pharmacies and just that's one slice of the whole system, and how complex it is. I think, to me, that just shows they do need, whatever they're asking for, they know how complex it is, what they need
Okay.
to analyze it. I mean,
Does it make any sense to let the bill, you're into this, the drugs and the PBM, does it make any sense to let that percolate through, then do this? Will some of that lower the cost of drugs on their own rather than piggyback this too soon on top of that? I don't know.
I
We're
think
doing a lot to get at the price of drugs and I just don't want too many hands to the brew here.
yes, I think the issue is it does take, because the system is so interconnected and complex, it's gonna take a while to see. We're gonna have some immediate effects with 233 with the copay accumulator, but some insurers are already doing that. And the H233 addresses one specific area and S98 addresses something different, a different part, a different way of looking at the whole system, not just the PBMs.
Okay.
Tupper?
Yeah, I'm just struggling with what the two people are going to do after they go through all the planning and all that stuff and implementation. I just trying to figure out,
So we have Green Mountain Care Board here who sure would like to fill us in.
Full-time drug forever.
well, it's a permanent, two permanent positions.
Yes, Susan Barrett, Executive Director. The language asks us to report out beginning of next year.
Yeah.
On the plans, we will do that. Then the next year, we have another report. I don't have the language in front of me. Implementation. Yeah, the implementation. So that will all be addressed in those reports. I will state for the record, we have 27 full-time equivalents currently at the Green Mountain Care Board. We regulate just for the hospitals, $3.5 billion in industry.
Yeah.
So we are a lean, mean machine. We are not. We struggle to get the work done that's in front of us now. So I think that is something I certainly I've already thought about that. Like, what are we going to do if we come out and we say, this doesn't make sense to do this? We'll report out, and then it really is up to, and I would say, you all can chime in, but I think it's up to future legislative body to determine what you want to do next, if that was the course of action. I can't predict what we're going to recommend at this moment in time.
And so then I guess my question is, why did we ask for permanent positions as opposed to limited service
That's a great
positions?
question, because one, recruitment for a permanent position, these are very specialized jobs, it's very unique work. The recruitment for a permanent position is a lot easier than a temporary position, that's one. And number two, in the Senate, the thought was this work would continue. So that's why they asked for permanent positions. We did not ask for the positions for the record either. This was part of the Senate bill. They initially asked for 5 positions. We went back to them with a more scaled down work and therefore scaled down staff.
Okay, thanks.
Art?
With that in mind, could we put something in the bill to sunset these positions in January of 27?
Well, that's the same thing, I think, as putting a limited services position in, which is hard to recruit for. So there's the weight, right? So
Yeah,
I understand the concern about 2 positions being permanent when this is, something that in 2 years, Green Mountain Care Board is going to come back to us and be like, yes or no. and it is very specialized work.
Right, no, I heard all this, yeah. Okay, so,
So there's the,
okay,
right.
so sunsetting the position wouldn't do anything that. Because the fund's gonna run out about then anyway, I thought we were.
well, and so that is a really good point, right? So if there is no money
Yeah,
for these two positions, there will be people in this building that will be making that decision.
yeah,
My experience in state government was if you have a special task that you wanted to take care of you, and I get it about recruitment. You put it in as a limited service position. And then after all of that's done, if you need somebody to continue in there to do certain things, not what they were doing, then you can get those positions made permanent and go from there. I just, you know what I mean? I having them permanent right away when we don't know what's gonna happen. We're gonna have to eliminate. Or are you gonna use them for? to
Yeah,
do-
no, I mean, I think what Chair Houghton said is if that, so two things, if the fund is depleted, I think it's people in this room, in this building to figure out A, how to fund them, and if they want to fund them based on the work we're doing at that time. That's number one, and I think I forgot number two, but I have a number two, and it'll probably come back to me.
Well, so I don't wanna make a big deal out of it.
Yeah,
But that's the reason that you do limited service positions, because you don't know what, if the funds are gonna be available or not. When you do a permanent position, that's permanent. You know you got the money to cover them.
Except I do think this is slightly different. It's a fund that is paying, not the general fund. So it is a special fund that is paying for
All
these
the
two
more reason, in
positions.
my opinion.
Right. So it's a policy decision we make, whether we keep it permanent and know that in 2 years, a decision will be made whether or not they are going to need to continue doing this work, because we're actually going to allow them to regulate prescription drugs. One is an option. Two is they come back to us and say, no, it's not gonna help anything. And then the people in this body decide what to do with those two positions. Or three, yes, we want to do it, but we have no money in the fund for the two positions. And so then that's a whole different decision. So I think those are what's before us. We could turn it into a limited services position. The counter thought there is, does it limit the people who are applying that where we need the expertise to do it? How I see this all.
And another way to look at that is if it's a 2-year position, if they're doing a heck of a good job, we're gonna wanna retain them.
Well, right, if the program is implemented.
Yeah.
Then yes, we're gonna need them because
Well, exactly.
it's gonna be.
But if we put them permanent now, regardless if it works out or not, they're permanent.
That's not necessarily true, because people in this body can make changes to those, if there's no funds.
I haven't
they go
seen that
away.
yet in 2 years.
Well. Can't help you with that.
Okay.
See, the thing is, you already know that it's being funded out of this special fund. And the people who are applying know that there's only money to support these positions for 2 years. That's why I'm confused
Well-
about having a permanent
I
position.
also want to say, the projections on the fund are just that, projections. Right? So Nolan, we're talking about the special fund for S98. And you had given us a chart that shows in the future year, the fund would be in the red.
Yes.
Not that I doubt your work, but those are projections.
Correct.
Okay. So there could be money there in 2 years. I think the question for me on the table is, can we get the expertise we need to determine if this program will work with the language that we have in as permanent? Could we get the same expertise if it was limited services position? Alyssa?
I'm fine with making them permanent. That's not my question. I'm glad Nolan walked in the room. Mine's more of a process question.
Okay, can we?
Well, it's not the special fund.
Oh, okay, go ahead.
If a special fund goes in the red, do we hear about that? I can't recall ever anyone.
Well,
coming
we're
in to
not,
say-
that's not us. It's Ways and Means. So go ahead, Nolan.
Okay.
If you can.
For the record, no language to it fiscal office. So the projections are based on two things. It's based on the steady state spending of certain things, which are been consistently in the fund. And any obligations you add to it, and what we think projections are going to be. In reality, is that future legislature could say, or future executive branch could see the fund is going to be in deficit and then take things off the list. And the proposal say, well, we took these off. They're not going to make a proposal, things are in the deficit. The question becomes, what do they take off? What do you agree with if they take off? Because they're been priorities of previous legislature. So it basically comes down to budget decisions will have to be made. You'll have to cut other things you like, you have to make priority.
So what if these positions end up being limited because the work runs out or whatever? The special fund goes into deficit. Will we be asked, or will a future legislature be asked to either eliminate the positions, or will they be asked to keep the positions permanent, turn them into something else, and then take them out of the general fund?
The executive branch in their government recommendations will make a recommendation based on so they may say, let's cut positions, they may say, let's not do some of the other things that we've been doing in the past. And just, the fund is in deficit based on proposals that may or may not happen in the Senate side.
Mhm.
So there's still moving pieces. You guys the House increased the fund fee, the Senate not. So there's a lot of moving pieces.
That fee of 1.7, that's continuous, right?
Yes.
Okay, so that's,
The House increased it by up to 2.25, I think, so bring in an extra 1.3 million per year. Senate didn't do that.
yeah, okay.
There's a lot of moving parts.
Yeah, exactly.
Leslie?
Just to clarify, I've been thinking about that. So the House increased it, House Ways and Means increased it to 2.2, and then what happened? The Senate.
Thank you.
The Senate did a bunch of updates. The Senate did not increase the amounts, and they didn't do the same level of appropriations you did. It was all tied to H2 as well, so there's a lot of, there's moving pieces.
Yeah, so that's Senate Finance, is that where it works?
Senate Health and Welfare, I think, kicked it off,
So it's all over the place. Okay, got it. So we
still long.
can still think about a possible increase. Is that true or
You
not?
know what?
A possible increase?
In this bill?
Yeah. Well, no, of the fee.
I don't.
So that fund is fully funded.
We're not thinking of any increase.
No, I
in this
know that's
committee.
not our job, it's someone else's job, but we talk to other people, so I'm just saying, if that would be something to think possible. So
I don't think in the process.
No.
that it's like,
okay, thank you.
Art,
I don't know if we've taken testimony on this, maybe we have, and I blanked out with it, but do we have an agency or someone that has oversight over drug costs now?
No.
We have no one looking at it at all.
so that's not true. That's two different questions.
Yeah,
So Jen, do you want to talk a little bit about what we've done in the past with the AG's office?
Sure, Jen Kirby, Legislative Council again. So a fair amount of work has been done in the legislature trying to get at prescription drug costs, particularly through the Office of the Attorney General. But there are limited avenues for enforcement, given the national implications of prescription drugs and prescription drug costs. So no, there is nobody, and we also have the Agency of Human Services is working on the importation issue with the federal government. So there's certainly been a lot of attempts to address prescription drug costs in various ways, but nobody has regulatory authority per se.
Are there reports or things that point to the fact that prescription drug prices are artificially inflated and thus too high? Are there reports that indicate, I guess what I'm trying to get at, we don't know right now well, maybe we do, and that's what I don't know. Do we have a problem with drug price? I know we have a problem, we think, with being too high, but do we know it's due to something other than manufacture costs? Do we know there's a problem, I guess, before we institute this?
Well, I would say we do, based on the testimony we had on 233, and last year, I forget what the bill was last year, where we see all the various levels, right, that are involved in the pricing of a drug. So I would say, yes, we do have a problem. And I would say Vermonters feel there's a problem with the price they're paying.
Right, but that doesn't mean there is. That's a perception that things are too high, and I get that. But if my $100 prescription per day costs $100 to manufacture, ship, make, blah, 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 maybe it's not inflated. Maybe that's just the cost of the drug. I'm just trying to understand if there's a problem that we're trying to solve, or it's only a perception that there's a problem.
Topper and then Melanie.
For everybody, I think it's pretty clear that there is a problem with the pricing of drugs in the United States and Vermont especially. All you have to do is go across the border and you can get the same drug for way, way less.
Do they manufacture, do they do the
Same company,
Same company.
same company,
Same companies.
same company.
Alright.
I was just gonna echo that. I remember we heard testimony about the different pricings in different countries, European and Mexico, and I remember that there were significant percentage differences.
Even in the United States, you can get the same drug manufactured by the same company at a different drugstore at a different price. Because they've negotiated with the manufacturer in a, what do you call those, the PBMs?
Yeah.
Because they got a different price than Walgreens and CVS, whatever, CVS. So in my opinion, yes, there is absolutely a problem.
Matt, Maury, and then Alan.
I just want to comment on yes, I really want the Attorney General's office to help with the problems of uncompetitive practices, for example, and other issues. But the Attorney's General office addresses problems after way after they've happened, instead of trying to create a system where we can prevent things from getting to that point.
I think there was a question on the table of whether we change it to limited services or keep it permanent. If we want to take a straw vote on that. Any other questions? Alan, I'm sorry, I didn't go to you.
I'm still confused because
Okay.
I'd like to know what these two people doing for what, $250,000 for these two positions. What they're going to do different that we haven't tried to address through the federal government. Bernie Sanders has been fighting this for years and years and years. Are we going to get our money's worth?
So these two people will explore and create a framework and methodology for implementing a program to regulate the cost of prescription drugs, looking at all of these things. We can't answer that question. We don't know the answer to that question until they do the work. I mean, that's just how it is. So yes, is there a cost to determining whether your roof needs to be fixed? Sometimes. And then they come and they say, nope, it doesn't, but you paid, $400 for a consult or, $150 for my dishwasher that we did that on. It didn't need to be fixed. It was user error. So,
Predicting today.
I know.
Frank?
It's sort of a question and a comment. Like the question is, because I don't have the bill in front of me and I don't know if it even says it in it and it's a money thing. So it might be, but I think it's something that Green Mountain Care Board could potentially answer, like, how much? We're talking two people, 2 years, how much does it cost per person?
If I remember right, it was 250.
The sum of two,
245.
Thank you. So to me, if 245 total though. Yeah, okay, yeah. So to me, if 2 years go by and the work that those two people did for $245,000 saves Vermonters $245,000 over the next 20 years, it was worth it. So I think that chances are that they will. So to me, it's a worthy bet to make.
It'd be 500 for 2 years. 250 a year, right?
Well, then to me, if it saved $500,000 for Vermonters over 20, whatever the case may be, I think that small investment. But I think that the chances are they're going to save a lot more based on the testimony we've taken in this committee for 8 years.
I want to clarify something. The sum of $245 is appropriated in fiscal year 2025 for the positions. We are not appropriating it for 2 years, although we are requiring work for 2 years.
Okay.
So
Right, okay.
But I guess my point's the same. Yeah, like if we spend 500,000 over the course of 2 years and it saves $500,000 for Vermonters over any amount of time, then it was worth it. But I think based on the testimony we've seen, that it's going to be a lot more. Can I say one other thing quickly? Back to what you were saying earlier, Art, like, I see your point about how much can you actually save? Because if the manufacturing cost is $100, then it's $100. I think we've seen evidence of otherwise, but I'm guessing we're going to find that there are some drugs where there's a huge markup and some where there's very little, and we aren't going to be able to do much, you know?
Yeah.
So I agree with you, I guess, on that.
only if you want to make that motion, yes, that's fine. Daisy? Sorry, Brian, were you done?
Yes.
Okay, thank you. Daisy?
I think that's a good point, looking at the return on the investment and probability of the return on the investment. And also, in my head, I'm tying this back to what we just did yesterday with the yield bill and looking at how on earth do we address some of those costs? And it's through doing things like reducing the cost of prescription drugs that will make our insurance more. Driving down a lot of costs for everybody, including education.
Yes, and this does have the support. Remember, we had the Vermont NEAN. They support this bill in the hopes that it will help reduce the cost of prescription drugs, which is their second highest cost to the teachers' health insurance.
So for that reason, I really feel it's critical to invest in those two positions, and thinking about it from a workforce perspective, it's two jobs potentially for Vermonters, and it's two jobs that are required to really, the way I'm reading this, implement this work in the rest of the bill, because I couldn't walk in and do that. Like, we need technical experts, like we need people that can wow us, like Sebastian does when he comes in, right? He's able to translate, and like, I want someone like that in a role like this. Not that I want Sebastian to go anywhere. Like, we need someone to bring this bill to fruition who has that kind of unique expertise, and we're not going to get it if we offer them a limited service position. I can tell you that.
Where the chances are lower.
The chances are lower.
Much lower, maybe.
Anyone else?
I just one final thing. I'm gonna support this because I think there's enough merit in it. Make it happen, but if I'm here when this thing gets through and there's nothing, I will be very, very critical of keeping those positions.
Yeah.
That would be all. I mean, if they earn the keep, that's good. You're out of here.
I'll be right there.
How are we gonna know that? That they were worth their money,
Well, because they're gonna have to come back and report to us. I mean, that's in the bill.
okay?
So they're coming back,
Two
one
reports.
next year and one the year after. So people around this table will be making that decision.
And we'll have, and whoever's at this table will have a chance halfway through that to weigh in on it. So if they're not delivering, there's an opportunity to provide some, supervision or some guidance to try to see if, point them in a direction that might deliver. So it's not like there's two people who will be just running wild for 2 years and then come back with nothing.
I've seen a lot of that.
I know that happens in the world, yeah.
And I comment on a lot of property office with their pesticide here, the body will, I think the remote care board should get a hold of the property that have responded to us. We've gotten, like I've seen 3 that have gone crazy, think they're gonna get regulated. That's not what this book does.
No, it's not.
And I think they need to get out and say, hey, look, we're just starting the process.
Yep.
We just actually,
Well, hopefully those people are watching and and
absolutely,
read the legislation that says
right.
this is just exploring the possibility of creating, and then if they think it's appropriate, an implementation plan that comes back to us before anything else is done.
But that could be part of it.
But
They're coming up with a strategy, methodology and everything. It could be some sort of regulation of the pharmacies. That could be in their plan.
of a corner store pharmacy,
If they're looking at the whole picture,
and it would still have to come back. to
you're
this
right,
body.
but it's
Make
a
a decision.
possibility.
And they already are regulated.
Oh, no, I know.
But that's an interesting point, because what if we find out, it's probably not gonna happen. What if we find out that there's some
Yeah.
corner stores like milking price, like what gouging the prices that.
I don't think-
I don't think so either.
Part of it.
But then we would address it though. We would
There's
address
a
it.
whole lot where we might find out if we let these people do the work.
The first step is passing the bill out.
No, but
Has everybody asked all the questions they want?
Yeah.
Everybody asked?
Yeah.
Okay, then I would like to move the question on Molly's,
Okay.
motion.
Okay.
You're calling the question?
Oh.
Yes, I'm calling the question.
Yeah.
No, he's calling the question, meaning he's cutting off the bait. Are you okay with that? Yeah.
After I asked.
Yeah, he's checking to make sure everybody's okay with
We have
it.
to vote on it.
it's a voter's trouble.
This is a vote.
It's a vote.
This is a vote. Do you want to, so we are voting on the bill as we walked through with Jen today, which includes permanent positions.
Right.
All right, Mari, call the vote.
Representative Rebecca,
Yes.
Representative Carpenter.
Yes.
Representative Chena,
Yes.
Representative Cordis, yes. Representative Demar,
Yes.
Representative Farley Rubio,
Yes.
Representative Goldman,
Yes.
Representative Peterson,
Yes.
Representative, where are you? Black,
Yes.
Representative McFawn,
Yes.
and Representative Houghton.
Yes.
It's easy addition today. 11-0-0.
Great. So good work, everyone. This bill will go to the floor tomorrow, but then be moved to Ways and Means because of the fund.
That was real good debate. by the way.
Yeah.
I mean, this is good.
Good. I'm glad you appreciate
I
it.
came in here not wanting to vote for this, but this is
Oh, no.
better.
Glad we take the time to talk about it and everyone is. Well, with you this year. All right.
They're good questions.
Yeah.
Yeah, very thoughtful, and I think we need to do cost analysis and look at all that. Daisy's point, I looked back at my notes, Colin said, with the NBA. What was that?
Yeah.
So.
Right.
Do we have a break?
We do. So I've asked Mari to present this bill since she's our prescription drug guru. Thank you.
That's why we made the motion.
Right. So we're going to take a break until 10:30 when we can have our other legislative counsel with us. We have posted the latest version of S-192, so I ask that people skim it before we come in, although Katie will walk through it. Skim it and be ready with questions, and we'll be back. Please be in your seats at 10:30.